Okay, today is September 19th. Here with Dr. Hoffert. Have her slated right now. We're going to talk about CERT and ask just a few simple questions about the CERT program. Okay, Dr. Hoffert, can you explain what dental implants are?
Sure. Dental implants are basically a single replacement for a missing tooth. They're basically a titanium screw that's placed into the bone. The titanium becomes one with the bone so that the dentist is able to restore the tooth with some kind of crown that sticks out above the gum. And then you just have the restoration of what looks like a natural tooth back in your mouth. Dental implants are not painful, and most people are good candidates for dental implant surgery. There's a few exceptions, but the success rate is in the high 90s, somewhere in the 98 to 99% range.
Excellent. How are dental implants beneficial to patients?
I'm a person that actually has dental implants in my own mouth, and I found that the main benefit for me is to seem like you really have your natural tooth back in your mouth. It's very easy to clean, to floss around. It doesn't take a lot of maintenance, and it's easy for the dentist to take care of it in the office as well.
What is the important to operate? What importance is it to operate in the United States as opposed to a foreign country for the, say, dental implant training?
Well, one of the main benefits of training in the United States is just cost, and probably the amount of time that you get to spend in surgery. You're not traveling to Abu Dhabi or somewhere, random in the world where you have to spend the time traveling. You get to go many, many times, and because the proximity is so close, you really get a lot more experience that way, and a lot more guidance and hands-on training. If you have a question in your own office, there's somebody there to contact and help you.
Why is it important to operate on the live patients?
Wow, I couldn't express enough how important the live patient experience is. I think, of course, repetition for the dentist and the surgical procedure is really, really important. And the great thing about the Foundry and the CERT program is the amount of patients that are here and the amount of surgeries that you actually get your hands into. You can't say enough about how important that is.
How beneficial is it to learn under the guidance of experts like Dr. Michael McCracken and Dr. Guy Rosensteel?
Well, they're not just experts, but Dr. Guy and Dr. Mike are two of the best people that you will ever meet. They're so kind and they're so helpful, and their guidance just makes you feel absolutely comfortable with the surgeries, with the patients, with the facility. I can't imagine having done this program with really any other kind of doctors. That kind of support that you get here will really further your confidence and your abilities.
What benefits do you foresee by having taken this course in your practice?
One of the best advantages of taking the CERT course is that right away you can put it into practice. You can go immediately from your first day of surgery at CERT and do something at your own practice. So
That's wonderful. Now, did you place dental implants before CERT?
I had a very limited experience in dental implants before coming to CERT. I had placed a couple and observed a couple implant surgeries while I was in the Air Force, but at CERT I was really able to get tons of hands-on learning and experience that I don't think I could have gotten in a different kind of program.
And how is CERT different than other dental courses, implant courses?
It's hard for me to say how CERT is different because I haven't experienced any other dental implant courses except for my time in the residency in the Air Force that I did. I think probably the biggest difference in the experience is the amount of hands-on live patient surgeries that you're going to be able to attend and assist on and watch, and but beyond that I can't really say, but I have the impression that other dentists don't get as much hands-on time, as much surgical time with implants as they do here at CERT.
Pardon me. Hello?